All right, let's talk about a neurological condition with a pretty complicated sounding name, Syringomyelia. But I promise you, the idea behind it is actually surprisingly simple. And by the end of this, you're going to understand exactly what it is, why it happens, and what it really means for a patient. Let's dive in.
So, I want you to start with a simple but really powerful image. Picture your spinal cord like a super important cable, right? It's carrying all these critical messages from your brain to the rest of your body. Now, what if a bubble started to form deep inside that cable, slowly getting bigger and pressing on all the little wires inside? Just hold on to that idea, because it's pretty much the key to understanding everything else we're about to cover.
So what is this bubble in the cord really? In this first part, we're going to break down the actual definition of syringomyelia. We'll cut through all the medical jargon to get to what's really going on.
Okay, so at its core, syringomyelia is all about this thing called a syrinx. That's the official term for the bubble we just imagined. The word itself actually tells you the whole story. It comes from the Greek word syrinx, which means a pipe, and melia for the spinal cord. So it literally means a pipe in the spinal cord.
And these analogies really help make it clear. You can picture the spinal cord like a solid wooden dowel, and the syrinx is this swelling that's happening from the inside out. Or we can just go back to that first image, a bubble growing inside a critical electrical cable. Both of those visuals capture the same basic problem of internal pressure and disruption. So, of course, this leads to the next big questions. I mean, if you've got a pocket of fluid, where on earth did it come from? And maybe more importantly, what kind of trouble can it actually cause? This is where the story starts to get really interesting.
And that brings us to what is maybe the most crucial point to get about syringomyelia. The bubble itself is almost never the real problem. It's a symptom, a side effect of something else going on. So in this section, we're going to play detective and find the real culprit, the blockage.
Yeah, this is the main takeaway right here. The syrinx is a secondary issue. The best way to think about it is like a puddle forming on your floor because of a blocked drain. Sure, you can mop up the water, but until you clear that drain, the puddle is just going to keep coming back. In our case, the blockage is in the normal flow of cerebrospinal fluid, or CSF. That's the liquid that cushions and protects our brain and spinal cord.
And this slide lays out the most common chain of events perfectly. A lot of the time, it starts with something called a Chiari malformation. That's just a condition where a little piece of the brain tissue sits too low in the skull. You can see how that creates a physical blockage. It's like a cork in a bottle. The pressure from the CSF builds up behind it, and that fluid can get forced right into the center of the spinal cord, and boom, that's how the syrinx forms. It's a pretty clear cause and effect chain reaction.
Now, while Chiari is the usual suspect, it's not the only thing that can cause this. Pretty much any physical obstruction can do it. A bad injury that leads to scarring, spinal tumors, or a condition called tethered cord syndrome. And then sometimes, and this is really frustrating for everyone, doctors just can't find a clear cause at all. They label that idiopathic, which is basically a fancy way of saying the main problem is still a mystery.
Okay, so we get the what and the why. It's a fluid bubble that's caused by a blockage. But how does that internal pressure translate into what a person actually feels day to day? In this next part, we're going to connect the dots between the anatomy and the actual symptoms a patient experiences.
Remember how the syrinx forms right in the very center of the spinal cord? Well, as it expands, it pushes outwards. As it grows, it starts to press on and stretch and eventually damage all the nerve pathways that are so neatly organized inside the cord. It's this inside-out pressure that causes the very specific and sometimes, frankly, bizarre symptoms of this condition.
So, the very first nerve fibers that this expanding bubble usually hits are the ones that cross over in the center of the cord. And, as it turns out, those specific fibers are the ones that carry information about pain and temperature. At the same time, the pathways for things like fine touch and knowing where your body is in space, those run in a different part of the cord and are often spared. This creates this incredibly weird situation called dissociated sensory loss. I mean, think about this. Someone could burn their hand and not feel the pain at all, but they could still feel the light touch of a feather on that exact same spot. Wild, right?
And because the syrinx most often forms up in the cervical spine, that's your neck, this strange sensory loss usually shows up in a very distinct pattern. It drapes over the shoulders, the back, and the arms, almost like someone is wearing a cape. It's such a classic textbook sign that when neurologists see it, their minds immediately jump to syringomyelia.
And of course, the symptoms a person has depend entirely on where that bubble is located.
If it's in the neck, it messes with the hands and arms first. If it's a bit lower down, in the thoracic or chest area, it can weaken the core muscles that hold you upright, which can sometimes even lead to scoliosis, a curvature of the spine. And if it extends all the way up into the brainstem, that's a condition called Syringomyelia. Well, then it can affect the most vital functions we have, like breathing and swallowing.
So with all that in mind, the obvious question is, what can we do about it? Well, the approach to treatment is guided by a really careful and logical philosophy, which we're going to explore right now.
The first rule of thumb is often do no harm. So if a syrinx is small, it isn't growing, and it's not causing any symptoms, the approach is usually to just watch and wait with regular MRIs. If something does need to be done, the absolute top priority is to treat the main cause. You've got to fix that blocked drain. So decompressing the Chiari, or removing a tumor, can actually allow the syrinx to shrink all on its own. Draining the syrinx directly with the shunt is really a last resort, because that procedure comes with its own set of risks down the line.
And this table really sums up that whole decision-making process. Doctors are going to step in and intervene when things are actively getting worse. If the syrinx is growing or the symptoms are progressing, but they're going to monitor when things are stable. It's a really dynamic process that's tailored to each and every patient. And the prognosis, or the likely outcome, is tied directly to what caused it in the first place. When the cause is a clear-cut mechanical blockage, like that Chiari malformation, the success rate for surgery is really high. We're talking 80 to 90%. But when the cause is something like widespread scarring from an old injury or infection, it's just a lot tougher to treat because that scar tissue can just keep coming back.
Okay, finally, let's look ahead. Even though we know a lot, there are still some major challenges. So where's the research headed, and what does the future hold for treating this condition?
One of the biggest clinical challenges is diagnosing this in young kids. As doctors will tell you, kids are just tough. They experience pain differently than adults do, they don't complain about it in the same way, and trying to figure out if a child is truly in pain versus just being scared or upset in a hospital setting is incredibly difficult.
Believe it or not, some of the most promising insights are coming from a totally unexpected place: veterinary medicine. It turns out that Cavalier King Charles Spaniels were selectively bred to have these really small, cute skulls, which accidentally led to a super high rate of both Chiari and Syringomyelia. Well, in a fascinating reversal, breeders are now actively working to select for larger skulls, and they are already seeing the number of cases go down. It's a pretty powerful lesson we're learning from our canine pals.
So looking forward, researchers are really hopeful about using things like big data and AI to sift through tons of patient information to predict who will respond to which treatment. They are continuing to learn from animal models like those dogs, and while it's still very much in the experimental phase, some are studying whether stem cell therapy could one day help reactivate cells that were damaged by the syrinx. It's important to stress, though, that is not a standard treatment today. But for all of this incredible progress, we have to end on a pretty sobering reality. Because those early symptoms can be so vague, a nagging pain here, some weird numbness there, it can take, on average, 3 to 4 years for a patient to finally get an accurate diagnosis. That's 3 to 4 years of living with uncertainty.
And that leaves us with one last, really crucial question. This condition is treatable, and the outcomes can be really, really good, but only if it's caught. Knowing just how subtle and sneaky its symptoms can be, maybe the biggest challenge moving forward is simply awareness and figuring out how we can shorten that long diagnostic journey so patients can get the help they need a whole lot sooner.